Dr. Robert Amler is Dean at New York Medical College, a former CDC epidemiologist as well. He told me about problems that may be encountered with such a vast vaccine rollout.
This really is a very important moment in the history of this horrible virus that has killed so many millions of people around the globe. Finally, we have a tool that will be both safe and effective at stemming the tide of this terrible epidemic.
What is the single biggest problem you can envisage in mass immunization?
You know, problems arise anytime you're trying to get a product out quickly to a lot of people as quickly as possible. There can be some wastage along the way, either because some pallets are misplaced or lost. Probably the biggest problem is temperature control, because we have heard that this is a vaccine that must be kept within very tight parameters of temperature in order to not lose its effectiveness.
Everyone needs 2 shots. How does that complicate this effort?
It really makes it complicated because we have to take very good records of who comes in, who gets the vaccine, and how we can get them back, because it's a very common occurrence. People come in, they get a dose, and then they either forget about the second dose or they get busy doing something else and they get lost to follow-up. So that's essentially a wasted dose that someone else could have had. So we have to do the follow-up and register people and be able to contact them, bring them back in when it's time for that all-important second dose.
And just to be clear then, if you get the first jab but not the second, it's a complete waste of time.
It may not be a complete waste. There is probably some immunity, but we will never really know now. And maybe eventually we'll find out what happens to people who only get the first jab. But the recommendation is 2 doses. If I were you and for me, we're going to get those 2 doses.
One vaccine has been approved. How important is it to get other vaccines out there?
The more vaccine out there, the better it's going to be, because we're talking about vaccinating not just thousands of people, not just millions, but hundreds of millions and billions of people worldwide. So every manufacturer that can give us a worthwhile vaccine, we will appreciate, and we'll go right to work making sure it gets distributed as quickly as possible.
Dr. Robert Amler there. Meanwhile, the first freezer-packed